COVID-19 has added a new dimension now because we've essentially closed down our stem cell transplant program for both myeloma and amyloidosis. Currently, we consider those elective procedures, and patients with amyloid already have pre-existing conditions: chronic heart failure, chronic kidney disease, chronic liver disease. So they're automatically higher risk patients in a healthcare setting to contract COVID and have a higher case-related mortality than the general population. So we've put that completely on hold. We've increased the number of telehealth consults we're doing with patients. We're asking that they receive their therapy much closer to home. We're a very large institution, so the patient density when we're at full capacity is very high. We think that's something that needs to be avoided, even with uniform masking, hand disinfection, and the like. We're concerned that having the inability to social distance is going to be a real problem for our patients. And so we're asking them basically to stay away, and we're following them with local laboratories, and we've been following them with video consultation. We've been very fortunate because Celgene Corporation recently announced the relaxation of their rules, which originally allowed only for dispensing 4 weeks of lenalidomide or pomalidomide at a time. Now they're willing to dispense 8 weeks at one time. And that allows patients that require a clinic visit to do so once every 8 weeks. So it halves the amount of exposure they have to the healthcare environment. And that has been really tremendous advantage. The amyloid population and the myeloma population are characterized by having immunoglobulin deficiency. Even patients with IgG myeloma who have a normal IgG level almost certainly don't have normal functioning immunoglobulins. The IgG is all the monoclonal IgG and has almost no efficacy in infection protection. So our patients, even when not neutropenic, are set up for increased risk of infections. And of course, since daratumumab is so widely used in this population, and that increases the risk of upper respiratory infections, these patients are facing multiple threats to the immune system that makes them uniquely exposed, or not increasing the frequency of infection, but uniquely predisposed to develop serious complications once they become infected.